Injection points don't really help you with chins. I found chins one of the hardest areas to get right. And the reason is, if you look at Chloe's face, all of the planes of her face are all meeting at just one point. So when you're injecting, you can't just look at the chin. We have to look at all of the planes that create the lower third of the face. Because the chin, as I always say, is the cherry on the bottom. It's the base of the presentation box for the eyes. So your injection points must be continuing these other surfaces. We have an anterior, a lateral surface on either side, and even an inferior surface that are all angled down towards the injecting point on the chin. So when you're injecting the chin, you need an aesthetic potential in your mind, not an injection point. And the aesthetic potential is built from the planes that lead towards the chin. They're not built by the anatomy of the artery or the bone. It's an aesthetic creation. It's a very different way of thinking about aesthetics as opposed to injection points. In fact, I think it's the missing piece in aesthetics training to understand how you can reach your aesthetic potential. It's nothing to do with anatomy. It's nothing to do with technique. Those things are simply the tools we use or the obstacles we face to create aesthetic potential. In the past few years, I've developed a framework to help clinicians make aesthetic decisions, not anatomical decisions or filler decisions, but aesthetically guided decisions to help them make their patients more beautiful in a much more structured way. This framework, I believe, is the missing piece in aesthetics training, and it shows you why, not just how to inject. It'll remove so many of your frustrations when you really get this.